Have you ever walked into a room and felt your heart racing so fast you thought everyone could hear it? This often happens when your mind creates disaster scenarios about simple conversations. When you avoid social situations, even ordering coffee or making small talk, not because you don't want a connection, but because the fear is unbearable. This isn't shyness. It's not being introverted. It's social anxiety disorder. And it's one of the most misunderstood mental health conditions affecting millions of people right now. You might not expect this, but here it is. Social phobia isn't about lacking social skills. It's a neurobiological response that hijacks your nervous system. But here's the hope. Clinical psychology has proven that overcoming social anxiety is absolutely possible with the right approach. In this video, we'll explore the hidden causes of social anxiety, recognize the real symptoms beyond just being shy, and walk through evidence-based solutions that actually work. Let's uncover the truth about social anxiety disorder, starting with what's really happening in your brain. 1. The hidden causes of social anxiety disorder. Social anxiety doesn't appear from nowhere. It has roots. Carl Jung observed that everything that irritates us about others can lead us to an understanding of ourselves. But with social anxiety disorder, the irritation is turned inward. Constant fear of being judged. Put simply, your brain has learned to perceive social situations as threats. The causes include genetic factors. If your parents had anxiety disorders, you're more likely to develop one. Early experiences matter too. Bullying, rejection, or criticism during formative years can wire your brain for social fear. But here's the neurobiology of social anxiety. Your amygdala, the fear center, becomes hyperactive in social situations. It sounds the alarm before you even enter the room. Meanwhile, your prefrontal cortex, the rational part, struggles to override that false alarm. This isn't a sign of weakness. It's brain chemistry. Your nervous system is stuck in a threat response pattern that made sense once but doesn't serve you now. Understanding this removes the shame. You're not broken. Your brain just needs retraining. 2. The real symptoms that go beyond shyness. Symptoms of social phobia go way beyond feeling nervous at parties. Physical symptoms hit hard, and they include a racing heart, sweating, trembling, nausea, and difficulty breathing. Your body enters fight or flight mode because it genuinely believes you're in danger. Panic attacks in social settings are common. Sudden, overwhelming waves of terror. Mental symptoms include constant worry before social events, intense fear of being judged, and brutal self-criticism afterward. You replay conversations for hours, analyzing every word you said, convinced you embarrassed yourself. What are the behavioral symptoms? They include avoiding social situations entirely, turning down invitations, staying silent in meetings, ordering online instead of shopping in stores. This is when severe shyness for social anxiety becomes clear here. Shyness is discomfort. Social anxiety is life-limiting fear. The difference between feeling awkward socially and having social anxiety disorder is intensity and duration. Everyone feels nervous sometimes. But if fear of judgment controls your daily decisions and lasts 6 months or more, you're dealing with something that needs attention. Recognizing these symptoms isn't about labeling yourself. It's about getting the right help. 3. The judgment trap and why it feels so real. The core of social anxiety is the fear of being judged. But let me show you why this one fact you need to know. It's not really about others. Marcus Aurelius wrote, "You have power over your mind, not outside events. Realize this, and you will find strength." This means that feeling judged in social situations is often your own harsh inner critic projected outward. Social anxiety and low self-esteem feed each other. You assume people are noticing your every flaw because you're hyper-focused on those flaws. In reality, most people are too worried about their own performance to scrutinize yours. This is called the spotlight effect, the belief that everyone's watching you when they're actually not. Your brain tricks you into thinking you're center stage when you're barely on anyone's radar. Here's the harsh truth. The judgment you fear most is your own. That voice telling you you're awkward, boring, or embarrassing, that's not the room talking, that's your anxiety. Understanding this doesn't make the fear vanish instantly, but it starts shifting your focus from what are they thinking to what am I thinking about myself. Before I proceed, count yourself as an exception for making it this far. Most people avoid learning about social anxiety because facing it feels too uncomfortable. 4. Cognitive behavioral therapy (CBT) for social anxiety is the gold standard treatment, and it works. Aaron Beck, who developed cognitive behavioral therapy, discovered that changing thoughts changes feelings. That in essence signifies that your anxious thoughts aren't facts, they're interpretations you can challenge and change. Here's how CBT for social anxiety works. First, you identify the automatic thoughts. Everyone will think I'm stupid, or I'll humiliate myself. Then you examine the evidence. Is that thought based on facts or fear? Usually it's fear. Next, you replace distorted thoughts with realistic ones. Not fake positivity, realistic assessment. Instead of, I'll definitely embarrass myself, try, I might feel nervous, but I've handled social situations before without catastrophe. So the behavioral part is gradual exposure. You face feared situations in small steps. Start with low-stakes interactions, such as saying hello to a cashier. Build up to harder ones, like attending a small gathering, because each successful experience retrains your brain. Treatment for social anxiety through CBT typically shows improvement in 12 to 16 weeks. That's not overnight, but it's not forever either. The work is uncomfortable, but crippling social anxiety responds to consistent practice. Number 5. Exposure therapy. Avoidance keeps social anxiety alive. Exposure therapy kills it. Pema Chodron teaches about moving toward difficulty rather than away from it. What this means is that the situations you avoid are the ones you need to gradually approach to heal. Exposure therapy for social phobia means creating a fear ladder. Rank situations from least to most anxiety-provoking. Maybe texting someone is a 2 out of 10. Making a phone call is a 5. Attending a party is an 8. Speaking in public is a 10. You start at the bottom. Face the 2 repeatedly until your anxiety drops. Then move to the 3. Slowly climb the ladder. Each exposure teaches your brain, this situation didn't kill me. I survived. The fear was worse than the reality. This isn't about forcing yourself into terrifying situations unprepared. It's systematic desensitization, building confidence through repeated, controlled exposure to what scares you. Getting over the fear of people happens one small, brave step at a time. The keyword? Small. You don't need giant leaps. Tiny steps compound into transformation. 6. The medication options. Sometimes brain chemistry needs biochemical support. That's okay. Viktor Frankl taught that the meaning comes from facing suffering, but he never suggested suffering needlessly when help exists. This means that social anxiety medication options aren't a weakness. They are tools you can willingly take advantage of. SSRIs for social anxiety disorder. Medications as sertraline or paroxetine can reduce the baseline anxiety that makes therapy so difficult. They don't cure social anxiety, but they lower the volume enough for you to do the real work. Beta blockers help with performance anxiety, the physical symptoms before presentations or important events. They calm the racing heart and shaking hands without affecting your mental clarity. Benzodiazepines work fast for acute anxiety, but carry addiction risk. They're typically short-term solutions, not long-term management. The evidence-based interventions for SAD often combine medication with therapy for the best results. Medication creates space. Therapy teaches skills. Together, they're more effective than either alone. Talk to a psychiatrist or doctor about what might help. There's no shame in using medication as part of your recovery toolkit. 7. Building long-term resilience through daily practices. Recovery isn't just professional treatment, it's daily habits that support nervous system regulation. Jon Kabat-Zinn brought mindfulness into medicine with one insight. Present moment awareness reduces anxiety about future judgment. Put simply, when you're fully here, you're not catastrophizing about there. Daily practices include mindfulness meditation. Even 5 minutes calms your nervous system. Deep breathing before social situations activates your calming response. Progressive muscle relaxation releases the physical tension that anxiety creates. Self-compassion matters enormously. Treating yourself with the kindness you'd offer a struggling friend can reduce the harsh self-judgment that fuels social anxiety. When you mess up socially, and everyone does, respond with understanding, not criticism. Social anxiety disorder recovery stories all share common elements: consistent practice, patience with setbacks, and self-compassion through the process. Nobody heals in a straight line. Tips for managing social interaction anxiety include preparing conversation topics beforehand, focusing on listening rather than performing, and remembering that silence isn't a failure, it's normal. Conclusion. Before I let you go, remember this: social anxiety disorder is real, treatable, and not your fault. Share one small step you're taking toward managing social anxiety in the comments below. What resonates most from this video? Let's support each other in this journey. If this video gave you any hope or clarity, hit that subscribe button and the notification bell.